What does informed consent for clozapine, otherwise known as Clozaril, look like? My name is Dr. Ruth Dutton. I'm a board-certified adult psychiatrist, and I talk a lot on this app about the importance of providing full informed consent when starting a psychiatric medication, as well as the importance of safety prescribing when clinically appropriate. I'm going through a series where each day I talk about one of our most commonly prescribed psychiatric medications, and I go through the informed consent process as I would with one of my patients. And today we're going to talk about clozapine, otherwise known as Clozaril. And although I wouldn't say that this is one of our most commonly prescribed medications, it is probably one of our most high-risk medications, so I think it's worth going through. So Clozaril is our most effective and powerful antipsychotic medication. It is an atypical antipsychotic and is usually reserved for people who have failed at least 2 other antipsychotic trials. And that's because studies have shown that when it's the first line antipsychotic, it doesn't outperform the others, but when it's used for patients who have failed other antipsychotics, it is much superior. So it can definitely be life-changing for some. In addition to treatment of psychosis, it's also FDA approved for SI, as well as agitation or violent behavior. It's also useful for older individuals who have Parkinson's disease, and it may have other indications, but because it's so high risk, it's usually only used for the things for which it has FDA approval. Why is clozapine so high risk? Well, it all started with a study that showed that there was an increased rate of agranulocytosis, which is a very dangerous condition where one of your white blood cell types gets very low, and so it leaves your body very vulnerable to infections and you're not able to fight them off, so a common cold could be deadly. Now, future studies have not showed as high of a rate of occurrence of this condition with clozapine, and there was previously something in place called the clozapine REMS, which basically was a regulatory agency that mandated that you check weekly complete blood counts, which would show the level of this white blood cell count for the first 6 months, bi-weekly for the next 6 months, and then monthly indefinitely. And if you didn't comply with this, then you couldn't prescribe the medication, pharmacists wouldn't fill it. And as you could imagine, because this is used in very high-risk individuals, that could be potentially really dangerous. So after more years of use and years of study, we've shown that the risk of this agranulocytosis is not as high as it was initially thought to be. And we've actually recently done away with this clozapine REMS protocol. So although monitoring of the complete blood count on a regular basis is still recommended, as it is with a number of other psychiatric medications that can cause the same condition, it's not mandated in the same way. But beyond that, there are a lot of additional potential side effects. One way in which it's better than the other antipsychotics is that it's actually really helpful for extrapyramidal symptoms. So those are those symptoms like tardive dyskinesia, dystonias, tremors, Parkinsonian symptoms. And so this medication is unique in that it actually makes those things better and does not worsen them in general. As far as metabolic side effects, though, it's probably the worst. It's up there with olanzapine and quetiapine. So it is going to cause an increase in appetite. It is going to cause weight gain, most likely. And there's the risk of things like elevations in cholesterol and blood sugar and worsening metabolic syndrome. So that is a major issue with this medication. And then when we think about the other side effects, we basically can go through every different system in the body and think of one. So neurologically, it can cause, of course, you can have things like headaches, but one of the risks is that it decreases the seizure threshold. Cardiovascularly, it is most likely going to cause tachycardia, meaning a rapid heart rate. And there's also the risk of cardiomyopathy, which can be very dangerous and lead to permanent damage. As far as your GI system, this can actually be one of the most dangerous side effects because it causes severe constipation in a lot of individuals. And this can back you up so much that you're basically throwing up because there's no way out. So there can be nausea, there can be stomach upset, but constipation is the big one. So in most cases, people who are on this medication need to be on a bowel regimen. So some kind of laxative or stool softener or something like that. It can also cause drooling. That's a common side effect, as well as urinary issues. It's very sedating, and so it can cause people to feel drowsy, lethargic, have low energy throughout the day. Of course, it can be helpful for sleep if that's an issue. And like the other antipsychotics, there is the risk of neuroleptic malignant syndrome, so that is something we have to counsel patients about. If you want more details about that, I've done another video on that topic. Tremor, blurred vision, and sweating can all also be side effects. So as far as monitoring, we do need to monitor people's weights. We need to monitor their blood work, right? Their complete blood count, their comprehensive metabolic panel, their cholesterol, their lipids. We also need to monitor their heart rate and their vitals, as well as have an EKG on file. So why would anyone take a medication that has all of these possible side effects? Like I said, it is the most effective antipsychotic we have, and it can be absolutely life-changing for some who have really severe psychotic symptoms. So just like lithium, it's one of those high-risk, high-reward types of medications. Most people who are on this type of medication are not going to taper off because it's something that if they're taking it, it's really helpful to them. And the truth is we just don't have enough data to look at withdrawal from clozapine to know what those effects might look like or how long they might last. If there's another psychiatric medication that you want to hear me go through the informed consent process for, then please put it in the comments below. I'm also putting together an email list for anyone who's interested in my content because I may have future offerings like courses or resources that I want to be able to share with you all. So if you're interested, then send me a DM with your email. I promise I won't spam you. Wishing you all good mental health today, and I'll see you in the next one.